Hey YouTube, welcome back to another episode of Matters of the Heart with me, Cheryl Stewart. Thank you for coming back to my channel. In today's video, we will be discussing kidney disease. Okay, I know a lot of people think like, it ain't nothing, but it is something that is very serious, and a lot of people are walking around with some form of kidney disease and don't even know it. So I will be discussing for you in this video what it is, who's at risk, how many stages of kidney disease is there, also some of the symptoms that you may or may not have, and also what are the treatment options for people who have end-stage renal disease. Okay, so we're gonna hop right into it. Stay tuned. Okay, so what is kidney disease? Basically, kidney disease is a chronic renal disease where it's like your kidneys don't function like they're supposed to. That's pretty much it in a nutshell. It is not filtering the toxins and the extra fluid from your body like it should. So therefore, the toxins build up in your bloodstream, makes you really, really sick. And then guess what? You have to get some form of treatment, and we'll get into that a little later on. But that is basically the scope of some type of kidney disease or renal dysfunction, however you want to put it. So who is at risk for kidney disease? All right, for those people who have the high blood pressure, diabetes, those are the main two causes of kidney disease. And a lot of people don't understand how significant it is to keep your sugars under control if you have diabetes, keep your blood pressure under control if you have high blood pressure. Also, people who are obese, people who smoke, African Americans, Indians, all of us are at a higher risk for kidney disease. Okay, so what are some of the symptoms that you experience? A lot of people don't even have symptoms off the bat because renal disease is pretty much a gradual thing. Some people do have acute kidney injury where their kidneys just suddenly stop working due to like an accident or due to some type of medication they may have taken, and they probably had a reaction and the kidneys didn't filter it out well. So they'll have an acute kidney disease where it'll just like shut the kidneys down immediately. But over time, the kidneys will rebound and they'll start back functioning normally. However, those who have chronic kidney disease like myself, this has been an ongoing issue since the age of 4. So actually before 4, but the age of 4 is when I actually remember like vividly everything that happened. So, but actually my mom told me at 6 months, that's when she noticed the first sign that something was going wrong. And that's where she found out one of my kidneys weren't developed all the way. So, so that was a chronic issue for me, meaning it happens gradually over time. And like I said before, acute kidney injury is where it just stopped working all of a sudden, but then after treatment, it starts to rebound and then your body just, kind of readjusts itself. So let's talk about the stages of kidney disease. There are 5, okay? When you get to stage 5, you're in complete end-stage renal failure, okay? And that is, where I am right now. I noticed, I want to say in stages 3, I started to notice symptoms, okay? So let's talk about some of those symptoms. I was tired a lot, nausea, the vomiting, loss of appetite. And if you're losing weight too quickly because you're not eating, because you're sick, that means the toxins are building up in your body and it is making you very, very ill. Some people, get to a point where they're so sick and then they just don't make it because they didn't know they were suffering from kidney disease. So yeah, what else? Like I said, fatigue, sleep issues. Oh my gosh, I cannot talk about the sleep issues enough. I have complete insomnia. I'm up all night. I cannot sleep. When I do fall asleep, I'm right back up. And then my husband's like, girl, what you go to sleep? But I can't sleep because it's a side effect of the kidney disease. And also changes in urination. You will see a decrease in urination. I'm not saying that it'll stop completely, but you may see a change in your urination patterns. For me, mine started to decrease, I want to say in stage 4. That's when I had about 17-18% kidney function. And then it was just like, the more it progressed to stage 5, it was just like nothing. I mean, I try to make light of everything. I just look at it like this. Hey, I'm the main one that don't have to go to the bathroom when we go to the mall or when we going out of the house, you know, so I'm cool with that. But yeah, toxins build up because you're not urinating. So another one is muscle twitches, muscle cramps, also the itching. The itching, I can go on and on and on about the itching. It is the most annoying thing I have ever dealt with in my life. I mean, I have scratches all over because the itching is just, it's on a whole nother level. So yes, the itching, and then swelling. You can swell because you are retaining fluid. Your body is not ridding all of the extra fluid. So you may see swelling in your feet, your ankles, your hands. Mine comes in my stomach, my face, and my fingers. So please be aware if you are suffering from constant swelling, please make sure you bring attention to it with your physician. Also, you can build up fluid around the lungs and the lining of the heart, all of that. And then your blood pressure is difficult to control. So people, if you are dealing with any symptoms, even if you're not dealing with symptoms, but if you are, I want to stress it so much, please, please, please consult with your physician if you feel anything is wrong. Like, even if it's not, get tested. Please get a regular checkup. All it takes is just one blood draw to check your kidney function, to see how well your kidneys are functioning. If you have a decrease in function, please see a nephrologist. Make sure you take care of yourself, please, because it is not fun. It is dangerous. And if you don't seek treatment and you go into complete renal failure, you might as well go ahead and prepare, because if you don't get treatment, you know, I always say, I kind of use this analogy with kidney patients. We don't have an option as far as it goes, like with treatment, we don't have an option. The only option for us, which I'm about to get into now, treatment options, dialysis, kidney transplant. Those are the only 2 options that we have once you get into complete renal failure. So, dialysis is pretty much what everybody ends up, you know, choosing. Some people choose otherwise, and some people just don't want treatment. Unfortunately, those people pass away because the body is so toxic. It just can't rid itself of all of that stuff. And all of the organs start to shut down after that. So, and then transplant is not promised. And also transplant is not a fix. It's just a Band-Aid. It's only a Band-Aid, because who's to say how long your organ will last? We don't know. I had 2. You just don't know. Your body does what it wants. It will fight off what it wants. And some people keep theirs for 20 years, 30 years. I'm a part of a Facebook group where I see people who have had their kidneys for 35 years, and now all of a sudden they're back on dialysis because their kidneys started to fail. It is not a permanent solution. It is not a lifelong solution. However, it will give you a better quality of life when you get it, if you get a good one that cooperates. Unfortunately, I had one in 2017 that didn't treat me very well. But, you know, like I said, those are the only 2 options that you have for kidney disease. So I urge everyone to please, please, please get tested, get a checkup. It is so important. It's so important. I know, especially my male brothers out there. Brothers, I know y'all don't like going to the doctor, but please, for your girl, go and get a checkup. It's only a blood draw. That's all it takes. One blood draw to see where your levels are, and that's it. And that way, you want to be proactive instead of reactive. You want to catch it, because if you catch kidney disease in the beginning, if your function is down a little bit, you can get treatment to kind of prolong the process. So, and then too, diet plays a part too. You know, if you have high blood pressure, diabetes, please follow your diet. Follow your diet. Because if you keep it controlled, that can keep you out of that dialysis chair. That can keep you from going into renal failure. I want to say 90% of the people that that my fellow dialysis mates, 90% of them have high blood pressure or diabetes. I think I might be the only one in there that did not have that as a precursor to kidney disease, because I was born with the issue. So yeah, but if you can control your blood pressure, if you can control your diabetes, please do so, because 9 times out of 10, if you take care of your health will take care of you. And you will prevent yourself from having to suffer with, you know, having to end up on dialysis or what have you. You know, I have so many experiences that I could share, but I will get into that in another video. So if you guys have any questions, I just wanted to make this brief just to kind of give you an overview as to what kidney disease is. It's basically just 2 filters that you got in your body. Just think of a fish tank. You put a filter in your fish tank so that you can keep the water clean, so that you can keep it a clean environment for your fish, right? So it's pretty much the same thing. Your kidneys are your fish tank's filter. It filters out all of the junk. It filters out all of the stuff that it doesn't need. It rids all of that stuff. However, the more stuff we put in it, our bodies work so much harder to filter that stuff out. So if we're eating junk all the time, we're drinking sodas all the time, and you know, the salt and all that, our kidneys are so tired from working so hard to rid our bodies of that stuff via urination. So that's what I wanted to share with you guys today. Something very quick, very simple, and to plead with you guys to get tested. Make sure you just get regular checkups. That's all I ask, get regular checkups. If you have any questions for me, I will be glad to share anything that I know. And if I don't know, I have a very close relationship with my doctor. I can ask and get the answer for you. Drop a comment in the comment section below, and I will get back to you. I will answer all my comments. I love you guys. Please subscribe to my channel. Make sure you turn on your notification bell so you'll know when I'm posting. Also, give me a thumbs up. I really appreciate it. If you want to contact me, I will put my social media platforms in the comment section down below. Love you guys. Thank you so much. And don't forget, you can also purchase my book on Amazon.com. You can search Cheryl D. Stewart, and the title of the book is From Disaster to Design. I'm hoping that you will like it. Thank you so much for watching. See you soon.